MRI images often look noisier when using large volume coils. For example, large volume coils, body coils, head-neck volume coils, torso coils are incredibly versatile, but they come with a trade-off: lower signal-to-noise ratio, SNR, and higher susceptibility to noise sources compared with small surface coils. 1. Lower SNR because the coil is farther from the anatomy. 2. Large coils pick up noise from a bigger region. 3. Mechanical vibration and acoustic noise. 4. Higher RF power requirements. How to reduce noise when using large volume coils. Optimize coil choice. Use the smallest coil that fits the anatomy. Use multi-channel arrays whenever possible. Sequence adjustments. Increase NEX averages at the cost of time. Increase voxel size slightly. Reduce bandwidth carefully can increase distortion. Patient-related improvements. Better immobilization. Breath holds instead of free breathing when possible. Coaching to reduce motion during loud sequences. System-level improvements. Ensure coil is properly seated and not loose. Use padding to reduce vibration transfer. Confirm no RF interference sources nearby.